This document says you may owe $2,800. It is not a bill. Before you pay the provider, check 5 numbers. Together, they show whether the final bill makes sense. An EOB, or explanation of benefits, is the insurance company's summary of how it processed a claim. The layout varies by insurer, but the job is the same. Connect the provider's original charge to the amount the plan says may be your responsibility. We will use one fictional in-network emergency room claim. Actual plan rules and EOB layouts vary. Number 1 is the provider billed amount, $12,000. This is the starting price submitted to the insurance company. It is not automatically the amount you owe. Number 2 is the plan discount or network adjustment, $4,000. Because this is an in-network example, the provider agreed to a lower negotiated amount. That $4,000 adjustment is not added to the patient's responsibility. Number 3 is the allowed amount, $8,000. This is the amount the plan recognizes for the covered service in this example. Your EOB may call it an eligible expense, payment allowance, negotiated rate, or simply allowed. Watch the first calculation. $12,000 billed minus the $4,000 network adjustment leaves an $8,000 allowed amount. Number 4 is what the plan paid, $5,200. This is the insurer's payment after applying the fictional plan's rules. A plan payment is not always the allowed amount because part of the allowed amount may be assigned to the patient as a deductible, copay, or coinsurance. Number 5 is the line most people look for first. You may owe $2,800. Here's the second calculation. $8,000 allowed minus $5,200 paid by the plan leaves $2,800 in patient responsibility. But do not send payment from the EOB. It is still not a bill. The most important check is what happens when the provider's actual statement arrives. Place the provider bill next to the EOB. Check the patient's name, provider, date of service, claim number, and total amount due. In this example, the EOB says you may owe $2,800. If the provider bill also asks for $2,800, the totals match. You should still read the notes showing how much was assigned to the deductible, copay, coinsurance, or any non-covered service. Now, suppose the provider bill asks for $3,400. Do not assume the larger number is correct. CMS advises patients to make sure the your share amount on the EOB is the same as the amount on the bill. Call the provider and say, "My insurance EOB shows patient responsibility of $2,800, but your bill shows $3,400. Please explain the difference and confirm that every insurance payment and adjustment has been posted." Then call the insurer if the provider cannot explain the mismatch. Ask whether the claim is final, pending, corrected, or denied. That claim status matters. A pending claim may change after processing. A denied claim should include a reason and information about the plan's appeal process. Ask for the exact denial reason and appeal deadline. Do not ignore the provider's due date while you investigate. Tell the billing department that you are reviewing the insurance discrepancy and ask what happens to the account during that review. There are 3 fast warning signs. First, the provider sends a bill before you receive an EOB for the same claim. Second, the provider asks you to pay the network adjustment or discount as if it were patient responsibility. Third, the provider bill is higher than the EOB you may owe amount without a clear explanation. None of those automatically proves the bill is wrong. They tell you to stop, compare the documents, and ask questions before paying. Remember the 5 numbers: $12,000 billed, $4,000 adjusted, $8,000 allowed, $5,200 paid by the plan, and $2,800 you may owe. The EOB is not asking you for money. It is giving you the map you need to check the bill that does. Save this video until the provider statement arrives, and subscribe to Care Costs Unpacked for clear, practical guides to American medical bills and health insurance.